Hi, my name is Callie Orslak, and I conducted a literature review comparing neonaticide and infanticide worldwide. Society often portrays motherhood as universally joyful and instinctual, especially in the United States. Women are expected to feel immediate love and fulfillment after childbirth. However, this idealized view can silence those who struggle emotionally, psychologically, or socially during pregnancy and the postpartum period. Infanticide and neonaticide challenge society's idealized view of motherhood. Neonaticide occurs within the first 24 hours of life, while infanticide occurs within the first year. Though rare, with about 500 cases annually in the US, the impact is devastating for families and communities. Research suggests some cases may be preventable through early recognition of warning signs, better mental health screening, and stronger support systems. Nurses are often the first to notice emotional distress during pregnancy and postpartum, and recognizing that motherhood is not always joyful allows us to provide compassionate, trauma informed care. My research examined literature on maternal infanticide in the US compared to Africa, Asia, Europe, and the Middle East, highlighting how cultural, legal, and healthcare systems shape responses to maternal mental illness, unwanted pregnancy, and social stigma. In conducting this research, I primarily used PubMed and CINAHL to locate sources pertaining to my topic of infanticide and neonaticide. My inclusion criteria and search terms are as shown on the slide. Out of the 104 articles reviewed, 21 met inclusion criteria. The findings confirm that infanticide and neonaticide are rare, but their impact makes prevention essential. A strong link was found between neonaticide and pregnancy denial, where a woman is unaware or unable of knowing and acknowledging her pregnancy. Some women present in active labor without any prenatal care. For nurses, warning signs may include missed prenatal visits, inconsistent reporting, and lack of birth preparation. Internationally, women who committed infanticide were more likely to be young, socially isolated, of low socioeconomic status, and have a history of psychiatric disorders, particularly depression or psychosis. In some countries, these women were more likely to receive psychiatric treatment rather than imprisonment, reflecting recognition of postpartum illness. Infanticide is shaped by complex psychological and social factors, not a single cause. Many women later expressed regret, often wishing they had sought some help, highlighting how stigma and fear of judgment can prevent disclosure of distress or intrusive thoughts. This is especially important in postpartum care, where early assessment is critical. Nurses must view screening as an ongoing process. Risk factors include intimate partner violence, unstable environments, substance use, young age, limited healthcare access, and cultural presences. Prevention involves routine mental health screening, trauma-informed care, education, early psychiatric referral, and teamwork. Treating infanticide as a public health issue supports earlier and more effective intervention. Ultimately, this research underscores the ethical responsibility of healthcare professionals to recognize risk, reduce stigma, and advocate for the systemic support of vulnerable mothers. I just want to say a special thank you to Dr. Dowdell for being my mentor and faculty presence throughout this process, and for the Davis Family Summer Research Fund for making this all possible. If it wasn't for them, I would not have been able to complete this. Thank you.